Good evening to all. Good evening, Sona. So, good evening, one and all. Once again, welcome back to our YouTube channel, NANDA Nursing Live. So, फटाफट लाइव रे जोड़ी जाओ. Sagarika, good evening. So, good evening to one and all. प्रदीप द good evening. So, फटाफट वीडियो को लाइक कर दियो, शेयर कर दियो एवं चैनल को जो मैंने फर्स्ट टाइम देखो चैनल को सब्सक्राइब कर दियो. राइट हमें मॉर्निंग सेशन रे 270 क्वेश्चंस जा देखिथिले है ना नर्सिंग फाउंडेशन सब्जेक्ट रे चली छी डिस्कशन राइट. ओके जो मैंने भी लाइव देखो फटाफट वीडियो को लाइक कर दियो. ओके बेटा हम स्टार्ट करवा. So question number 271 is the inflammatory or exudative phase of wound healing will last for. The inflammatory phase or exudative phase of wound healing will last for. Option A is 1 year, option B is 1 to 4 days, option C is 5 to 20 days. So now good evening. 1 to 4 days, option C is 5 to 20 days, option D is 21 days to a month. So which option is the correct answer beta? Correct answer कर दिया. So correct answer is 1 to 4 days B. Option B is the correct answer. Very good. Option B is the correct answer. Next question. Question number 272 is which of the following is a primary nursing interventions necessary for all patients with a Foley catheter in places? Which of the following is a primary nursing interventions necessary for all patients with a Foley catheter in places? Option A, maintain the drainage tubing and collection bag level with the patient's bladder. Option B, irrigate the patient with 1% newsprint solution 3 times a day. Option C, clamp the catheter for 1 hour in every 4 hours to maintain the bladder's elasticity. Option D, maintain the drainage tubing and collection bag below bladder level. So which option is the correct answer beta? So correct answer है बेटा option D, maintain the drainage tubing and collection bag below bladder level, right? Below bladder level. Option D is the correct answer, right? Below bladder level करले बेटा कौन होगा? We reduce the infections, right? Risk of infections को हमें reduce कर पारेगा, right? Option D is the correct answer. Next question. Question number 273. While doing the tracheal suctioning of a patient, the suction should be applied gas. While doing the tracheal suctioning of a patient, the suction should be applied gas. Option A, only when withdrawing the suction catheter. Option B, only when inserting the suction catheter. Option C, either during insertion or withdrawal, depending on when the patient coughs. And option D, only if the patient coughs. So which option is the correct answer? So correct answer is beta option A. Only when withdrawing the suction catheter, right? While doing the tracheal suctioning of a patient, the suction should be applied only when withdrawing the suction catheter, right? Option A is the correct answer. Next question, question number 274. Which action by the nurse in charge is essential when cleaning the area around ejection pad on drain? Which action by the nurse in charge is essential when cleaning the area around ejection pad on drain? Option is cleaning from this the center to outward in a circular motion. Option B is cleaning from periphery towards center in circular motions. Option C is cleaning briskly around the side from the left to right. Option D is cleaning briskly around the side from right to left. So which option is the correct answer, beta? So correct answer is option A, beta, is cleaning from the center to outward in a circular motion, right? Injection plate wound drain, beta, this is a closed section medical devices, right? Closed section medical devices used after surgery to collect fluids from the surgical site. To collect fluids from surgical sites, right now. So nurse should clean the area around injection plate wound drain from the center to outward, center to outward, center to outward in a circular motions, in a circular motions, right? So option A is the correct answer, beta. Next question. Question number 275. The term resourcefulness implies. The term resourcefulness implies. Option A problem solving ability. Option B sense of belonging. Option C involvement in spiritual activities. Option D ability to handle stressful situations. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option A, problem solving ability, right? So resourcefulness is the ability to find clever and quick solution to problems, right? So option A is the correct answer. Option A is the correct answer, beta. Next question, question number 276. The nurse plans to teach a client about the importance of exercise. The nurse plans to teach a client about the importance of exercise. Option A, when there are vision in the room. Option B, when the client's pain medication are working. Option C, just before lunch when the client is most awake and alert. Option D, when the client is talking about current stressor in his or her life. So which option is the correct answer? Who option hobe beta? When there are vision in the room, সেটা হবো না when the client pain medication are working, যেତେବେଳେ patient pain medications କାମ କରୁଛି ସେ ସମୟରେ ଆମେ patient को exercise ବିଷୟରେ ଆମେ teach କରିବା ମାନେ ଶିକ୍ଷା ଦେବା କି just before lunch when the client is most awake and alert, and before lunch when the client most awake and alert, right? ସେ ସମୟରେ ଦେବା ନା when the client is talking about current stressor in his or her life, ये समझ दबा तर current stressor time रे दबा when patient talking about his or her current stressor in his or her life. So which option is the correct answer? But option D is the correct answer, right? And this is the most effective methods to teach about the importance of exercise. No. So option D is the correct answer, but option D is the correct answer. Option D is the correct answer. Next question, question number 277. Seat bath is given for which for the following? But I mean so discussion करते seat bath विषय, right now. Hemorrhoids and perineal issue जदि थिले हमें seat bath दोच है ना नहीं. So option A रही appendectomy, option B is hemorrhoidectomy, option C is cholecystectomy, option D is mastectomy. So which option is the correct answer? But seat bath is given for which for the following? So surgical removal of hemorrhoids is hemorrhoidectomy, है ना नहीं. हमें seat bath hemorrhoids and perineal issue रे दी थी. So option B is the correct answer. Very good. This is the surgical removal of hemorrhoids right now. Option B is the correct answer. But next question, question number 278. An opening of surgical wound edges is called. an opening of surgical wound edges is called option A रचे wound evisceration, option B रचे wound rupture, option C रचे wound approximation, option D रचे wound dehiscence. So which option is the correct answer बेटा? Which option is the correct answer? फटाफट आंसर कर दिया. Opening of surgical wound edges is called wound dehiscence बेटा. wound dehiscence already हमें किसी डिस्कशन करते wound dehiscence विषय. Opening of surgical wound is known as wound dehiscence, right? Option D is the correct answer. Very good. Next question, question number 279. Oxygen administration through nasal cannula. Oxygen administration through nasal cannula. Option A is 2 to 4 liters. Option B is 1 to 6 liter. Option C is 6 to 8 liter. Option D is 8 to 10 liters. So which option is the correct answer? So बेटा nasal cannula रे हमें नहीं कि low flow rates से दी था oxygen therapy, right? To deliver low flow rates oxygen therapy, right? To deliver oxygen therapy at low flow rates. हाँ ना नहीं लेनी चाहता बेटा. Oxygen administration through nasal cannula 2 to 4 liter, 1 to 6 liter, 6 to 8 liter, and option D is 8 to 10 liter. So which option is the correct answer बेटा? So typical low rate for oxygen administration कितने होगा बेटा? 1 to 6 liter, right ना? 1 to 6 liter. Option B is the correct answer. हाँ ना? Oxygen administration through nasal cannula, that is 1 to 6 liter per minute. है ना नहीं? So option B is the correct answer. Next question, question number 280 रही बेटा. A nurse taking care of patient with closed chest drainage and observe constant bubbling in the water cell compartment. A nurse taking care of a patient with closed chest drainage and observe constant bubbling in the water cell compartment during both inspirations and expirations. What the nurse should conclude? Option A, the system is functioning normally. Option B, the patient has developed pneumothorax. Option C, the chest tube obstructed. Option D, the chest has an air leak. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option D. Very good. Option D is the correct answer. The chest has an air leak. The chest has an air leak. Correct answer. Option D is the correct answer. Very good. Mamata Nag, Pradeep Tagore, Sonalika. Very good beta. Option D is the correct answer, right? Next question. Question number 281. Among the following, the factor that contributes to pressure ulcer is. Among the following factors that contributes to pressure ulcer is. Option A is chronic disease. Option B is malnutrition. Option C is edema. And option D is sharing forces. So which option is the correct answer? फटाफट answer कर दे बेटा. Which option is the correct answer? Right, option D is the correct answer. Right, option D is the correct answer. Very good. Sharing forces over, right? But sharing forces along with pressure, friction, and moisture are the key factors that develop pressure ulcers. Right now, beta. Sharing forces along with pressures, friction, and moisture are the key factors in that development pressure ulcer. Right, option D is the correct answer. But next question, question number 282. While suctioning of the patient placed ET tube in the mouth, suction catheter should insert. Option A is beta insert catheter till resistance are filled. Option B is total length of catheter. Option C is tip of the nose to ear and ear to chest. Option D is insert the catheter 10 cm only. So which option is the correct answer beta? While suctioning of the patient placed ET tube in the mouth, suction catheter should insert. Option A insert catheter till resistance are filled. Option B till length of catheter. Option C tip of the nose to ear and ear to chest. And option D insert the catheter 10 cm only. So which option is the correct answer beta? So which option is the correct answer? So correct answer is option A. Option A is the correct answer, right? Option A is the correct answer. Option A is the correct answer, right? Option A is the correct answer. Next question, question number 283. Precaution used when caring of a rubella patient. Precautions used when caring of a rubella patient. Option A is droplet. Option B is contact. Option C is universal. Option D is hand washing. So which option is the correct answer, beta? Precaution used when caring of a rubella patient. Option A is droplet. Option B is contact. Option C is universal and option D is hand washing. So which option is the correct answer? फटाफट आंसर कर दे बेटा. So which option is the correct answer? Which option is the correct answer? Very good, बहुत बढ़िया. Option A is the correct answer, right? When caring for a rubella patient, particularly postnatally acquired rubella droplet precautions are crucial for 7 day. Okay, 7-day period, and this is the onset of the rash. Is better. Option A is the correct answer. Option A is the correct answer, right? Option A is the correct answer, right? Droplet precaution used when caring of a rubella patient for droplet infections, right? Option A is the correct answer. Next question, question number 284. A patient receiving continuous salbutamol nebulizer therapy, nurse should assess for. A patient receiving continuous salbutamol nebulizer therapy, nurse should assess for. Option A serum calcium. Option B serum potassium. Option C serum magnesium. Option D serum sodium. So which option is the correct answer, beta? Which option is the correct answer? Question 284. A patient receiving continuous salbutamol nebulizer therapy, nurse should assess for calcium, potassium, magnesium, sodium. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option B, beta. Sodium. Potassium. Serum potassium is the correct answer, right? So patient receiving continuous salbutamol, so nurse monitor serum potassium because continuous salbutamol nebulizer can lead to hypokalemia. This is as a side effect, right? Hypokalemia hobo beta. Yetul continuous salbutamol nebulizer patient receive karchi, right? And this is the side effect of salbutamol nebulization. Side effect, right? So option B is the correct answer, beta. Option B is the correct answer. Next question, beta. Question number 285. A client is admitted with extrophy of bladder. What is the nursing action if bladder exposed outside the cavity? A client is admitted with extrophy of bladder. What is the nursing action if bladder exposed outside the cavity? Option A non-adherent dressing with normal saline. Option B dressing with petroleum jelly. Option C place clean plastic wrap. Option D betadine dressing. So which option is the correct answer? फटाफट आंसर कर दियो बेटा, फटाफट आंसर कर दियो. Bladder extrophy means beta bladder exposed outside the abdominal cavity, right now. And यही समय आमर nursing priority actions कौन रहिबो? So correct option होगा बेटा option A. Option A is the correct answer, right? Option A is the correct answer. Non-adherent dressing with normal saline, right? Non-adherence adherence वाला देले बेटा sticky ही जवाब मुझे पहले था sticking to the delicate bladder tissue, right? So हमें non-adherent सेथी पाइन दवा non-adherent dressing with normal saline करबा एथी पाइन जेमती sticky है कि चिपकी जीवने and further जेमती dressing changes टाइम रे किसी trauma हबो नहीं कि injury हबो नहीं. So minimize trauma during dressing changes. See if I am a non-adherent dressing with normal saline culture, right? Option A is the correct answer. Next question, question number 286. Identify which is the independent nursing interventions from the following. Identify which is the independent nursing interventions from the following? Option A inserting Foley's catheter, option B administering IV fluids, option C providing catheter care, option D collecting blood sample for investigation. So को काम बेटा इंडिपेंडेंटली करि परिबा हमें इंडिपेंडेंट नर्सिंग इंटरवेंशंस कोडा बेटा इंडिपेंडेंट नर्सिंग इंटरवेंशंस क्वेश्चन को पढ़ो समझो उसके बाद आंसर करना राइट सो करेक्ट आंसर बेटा हम providing catheter care. Option C is the correct answer, right? Providing catheter care is the correct answer. Option C is the correct answer, beta. Next question, question number 287 is beta. The purpose of bladder irrigation is option A is to remove blood and clots. Option B is to remove urine. Option C is to clean the bladder. Option D is to wash the bladder. So which option is the correct answer? फटाफट आंसर करो बेटा. Most important MCQ. कौन पाए बेटा ब्लैडर इरिगेशन हम करछे why we are doing bladder irrigation and what is the purpose of bladder irrigations so option A is the correct answer beta right to remove blood and clots and this is a sterile procedure beta this bladder irrigation is a procedure where sterile solution is flushed through a catheter into the bladder and drain out blood clots and debris right so option A is the correct answer haba beta option A is the correct answer हम तो यूरिन कैथेटर लगा देले बेटा रिमूव हो जो यूरिन हां नहीं bladder clean the bladder to wash the bladder ए बेटा जो क्लॉट थिबो ब्लड क्लॉट थिबो या ओन डेब्रिस थिबो से गुडा को हमको कण रिमूव करा जाउ छै ब्लैडर इरिगेशंस माध्यम रे राइट नेक्स्ट क्वेश्चन क्वेश्चन नंबर 288 इज बेटा while instilling ear drop in adult client most important आमे आई ड्रॉप्स ऊपर पढिथिले बेटा सकाळो एबे ear drops ऊपर पढिबा most important MCQ बेटा most important right very most important this question is very important for the upcoming examinations or OSSC nursing officer examinations so while installing ear drop in adult client the pinna of ears should pull option A upward and forward option B downward and backward option C downward and forward and option D upward and backward so which option is the correct answer beta very good option D is the correct answer beta option D is the correct answer right so beta this is for adult है ना नहीं इन चिल्ड्रन रे कौन करा जाए बेटा चिल्ड्रन रे करा जाए बेटा डाउन एंड बैकवर्ड डाउनवर्ड एंड बैकवर्ड राइट मन रखिता बेटा क्वेश्चन के चिल्ड्रन रो पचार केतरे एडल्ट रो पचार राइट सो पिना को हम केमती पुल आउट करबा डाउनवर्ड एंड बैकवर्ड करके इन चिल्ड्रन एंड एडल्ट जेतु इटी देची बेटा हम कोन करबा अपवर्ड एंड बैकवर्ड करबा मोस्ट इंपोर्टेंट बेटा ये सब मन रखियो पड़े हला या को भी मन रखो दिस इज फॉर एडल्ट अपवर्ड एंड बैकवर्ड राइट मन रखिए अपवर्ड मीन्स बड़ बड़ लोक मानकर कह डाउनवर्ड मीन्स छोट पिला मानकर हाँ ना नहीं बुझीपार तो डाउन मीन्स तलू ना छोट पिला मानकर मन रखिए से हिसाब से मन रखिए अपवर्ड एंड बैकवर्ड एंड डाउनवर्ड एंड बैकवर्ड राइट downward and backward for children and upward and backward for adults right now this is the instilling ear drop in adult client the pinna of ear should pull upward and backward मन रहा ना बेटा important MCQ next question number 289 अच्छे बेटा which condition is assessed by using Braden scale which condition is assessed by using Braden scale पूर्व क्वेश्चन आंसर डिस्कशन सेशन रे सब किछ चीज जानी थिले देखि थिले क्वेश्चंस राइट सो ऑप्शन रे बर्न इंजुरी ऑप्शन रे बैड सोर ऑप्शन सी रे मसल स्ट्रेंथ ऑप्शन रे एंजाइटी लेवल ऑफ पेशेंट सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा आंसर कर दो फटाफट जो मैंने जानी फटाफट आंसर कर दो वेरी गुड बहुत बढ़िया समस्त को जाना ऑप्शन बी इज द करेक्ट आंसर बेड सोर को एसेस करबा पय ब्राइडन स्केल यूज करा जाय हां ना नहीं ब्राइडन स्केल यूज्ड फॉर एसेसिंग व्हाट बेटा बेड सोर और प्रेशर अल्सर बेड सोर और प्रेशर अल्सर समझा ना राइट ना मुझे पढ़ लो नेक्स्ट क्वेश्चन नंबर 290 द ग्लासगो कोमा स्केल assess all the following parameter except Glasgow coma scale assess all the following parameter except option is motor response option B is verbal response option C is eye opening option D is memory so which option is the correct answer beta फटाफट आंसर कर दो सो हमें ग्लासगो कोमा स्केल रे कौन देखिए बेटा आई ओपनिंग रेस्पॉन्स है ना नहीं आई ओपनिंग response that is E then verbal response है ना नहीं verbal response जानी छना बेटा ये सब verbal response that is V and motor response that is M है ना this is GCS ये भाव रे हमें ये तीन पैरामीटर्स 3 जीसीएस 3 पैरामीटर्स आ ना नहीं जीसीएस 3 पैरामीटर्स रा हेल्प रे हमें एसेस कर छै ना के कॉन्शियस लेवल को हमें ये 3 पैरामीटर्स माध्यम रे हम एसेस कर छै सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा व्हिच ऑप्शन इज द करेक्ट आंसर सो करेक्ट आंसर इज ऑप्शन D accept देची ने के accept so option D is the correct answer very good question number 291 all of the following are included in the CLAP-C bundle except CLAP-C bundle except all of the following are included in the CLAP-C bundle except option A use a maximal sterile barrier when the insertion option B always try to insert a central line at the femoral vein option C scrub the hub before and after each use option D wash and before all procedure CLAP-C बेटा कौन CLAP-C रो फुल फॉर्म हमें ऑलरेडी पढ़ी सारी छे बेटा पुणी थर मु कह दूचे सेंट्रल लाइन राइट ना एसोसिएटेड bloodstream infections right so all are included in the CLAP-C bundle except so which option is the correct answer V very good option B is the correct answer beta option V is the correct answer all which try to insert a central line at the femoral vein या कुछ छाड़े की all are the CLAP-C bundle use maximal sterile barrier when the insertion this is the CLAP-C bundle scrub the hub before and after each use this is also comes under CLAP-C bundle and wash hands before all procedure this is also collapsive vendors, right? So option B is the correct answer. But next question, question number 292 rachi. The nurse knows that in which of the following poisoning case gastric lavage is not recommended. The nurse knows that which of the following poisoning case gastric lavage is not recommended. So option A is arsenic poisoning, option B is corrosive poisoning, option C is organophosphorus poisoning, option D is dhatura poisoning. So which option is the correct answer, beta? But option B is the correct answer. This is not recommended for gastric lavage. Otherwise कौन है बेटा? Esophagus and stomach perforation है भाई. Esophagus and stomach perforation है भाई. यदि हमें gastric lavage कर देगा, right? Injury हमार chance था बेटा. Right? So option B is the correct answer, right? So corrosive poisoning means beta acids poisoning, right? Acids poisoning. Chemical poisoning, acids poisoning, right? Next question, question number 293. Which is not the effect of cold therapy? Which is not the effect of cold therapy? Option A is vasodilatation, option B is vasoconstriction, option C is reduce pain, option D is stop bleeding. So which option is the correct answer, beta? Correct answer is option A, right? Option A is the correct answer, right? Cold therapy or cryotherapy, cold therapy or cryotherapy. Cryotherapy भी कहूँ ना बेटा, बार बार मैं कहूँ तुमको. Cold therapy or cryotherapy causes what beta? Vasoconstrictions. It causes vasoconstriction. है ना नहीं? Vasoconstrictions. Right? Narrowing the blood vessels. Vasoconstriction means narrowing the blood vessels. है ना नहीं? Narrowing the blood vessels. Right? And this is not effect of the cold therapy, that is for vasodilatations, right? Option A is the correct answer. And vasodilatation effect with which therapy, beta? Heat therapy. This is effect on heat therapy, not in cold therapy. Right? So option A is the correct answer. Right now? Next question, question number 294. Which procedure is not used in chest physiotherapy? Which procedure is not used in chest physiotherapy? Option A is nebulizer, option B is coughing, option C is vibration, option D is percussion. So which option is the correct answer? Answer करो फटाफट, answer करो फटाफट. Which procedure is not used in chest physiotherapy? Nebulizer, coughing, vibration, percussions. अरे माड़ो खाइबो कि सोनालिका. एटा ऑप्शन ए नेबुलाइजर दिया हुए कि चेस्ट फिजियोथेरापी रे ऑप्शन ए इज द करेक्ट आंसर आखि बंद करके आंसर कल हम ना टिके सोच समझ के आंसर करना पड़ेगा which procedure is not used in chest physiotherapy coughing vibration percussion इटे सब chest physiotherapy रे ये सब procedure used करा जाए right option A is the correct answer next question number 295 which one of the following is not a type of back massage which one of the following is not a type of back massage so which option is the correct answer effleurage option B is soaking option C is tapping option D is petrissage effleurage soaking tapping and petrissage so which option is the correct this is the back massage type of this is the type of back massage and which one is the not a type of back massage beta type of back massage mu तुमको कहि दउछि type of back massage कौन बेटा effleurage है ना effleurage then आउ कौन बेटा then tapping आउ कौन अच्छी बेटा petrissage है ना नहीं आउ कौन अच्छी circulations then कौन अच्छी बेटा compression आउ कौन अच्छी बेटा vibrations और vibrate and now कौन अच्छी kneading these all are about back massage type of back massage right this is all about type of back massage beta effleurage prestigious friction hand over a hand brush kneading tapping right thank you so हमें सातटा देखी थिले 7 type of back massage right so which one of the following is not a type of back massage beta soaking right option B is not a type of back massage right next question number 296 a patient on ventilator in ICU is having excessive secretion from the mouth on duty nursing officer doing suctioning she or he know that maximum time for suctioning according to protocols not exceeds more than most important MCQ most important MCQ beta 20 seconds 30 seconds 10 minutes 10 seconds आंसर करो को मैंने सक्शन करिछ पेशेंट्स को जाना पड़े जो मैंने बही भी पढ़ी थे से जानी so not more than 10 seconds very good not more than 10 seconds right option D is the correct answer right option D is the correct answer not more than 10 seconds next question number 297 the nurse is giving discharge advice to the patient after intraocular lens implant which of the following would be a wrong advice the nurse giving discharge advice to the patient after intraocular lens implant which of the following would be a wrong advice option A wear metal eye shield at all times wear metal eye shield at all times option B wash hand before touching or cleaning eye option C lie down on the side of affected eye option D bath or shampoo hair cautiously so which option is the correct answer So correct answer is beta option C, right? Option C is the correct answer. This is the wrong advice. Lie down on the side of affected eye. This is the wrong advice, right? So आम advice करबा कौन? Wash hand before touching or cleaning the eye. इटा advice करबा. Shampoo hair carefully, है ना नहीं? Shampoo hair carefully or cautiously. इटा आम advice करबा. So wear metal shield at all times. इटा भी आम advice करबा. है ना नहीं? बुझी पाला? When giving discharge advice to the patient after intraocular lens implant, right? So this is all about intraocular lens implant. Next question number 298. Evidence-based clinical practice recommendation of nursing care of the following except. Option is rapid identification and triage. Option which enable delivery of relevant time critical treatment. Option C, observe the patient. Option D, rapid transfer to acute stroke unit for treatment. So which option is the correct answer? So correct answer is option C, beta, observe the patients, right? Option C is the correct answer. Evidence-based clinical practice recommendation of nursing care of the following except observe the patients, right? So option C is the correct answer. Except कोई बेटा following except से पे observe the patient खाली हवा नहीं, right? So rapid identification and triage, enable delivery relevant time critical treatment, rapid transfer to acute stroke unit for treatment is all about evidence-based clinical practice recommendation of nursing care, right? So observe the patient haba nahi. So option C is the correct answer. Next question number 299. Which of the following is not an example of dry cold applications? Dry cold applications. Which of the following is not an example of dry cold application? Option A is cold compress. Option B is ice pick. Option C is ice cradle. Option D is ice bag. So which option is the correct answer, beta? Dry cold applications. So correct answer is beta option A, right? Option A is the correct answer, right? So cold compress is not an example of dry cold applications, right? Not an example of dry cold application. So cold compress kaana beta, we applying with material like a cloth and soak in cold water to an area which is moist. Cold application, not a dry one, right? That is cold compress, right? Option A is the correct answer. बुझी पाला ना बेटा? Cold compress means बेटा आमे cloth material apply करूचे, right? And soak in cold water and used in that. Option A is the correct answer, right? Now next question. Which of the following is not an example of dry heat applications? Which of the following is not an example of dry heat applications? Option A radiant warmer. Option B is hot packs. Option C is sun bath. Option D is hot water bake. कौन है बेटा correct answer? So your correct answer है बेटा option B, hot packs, right? Hot packs. So option B is the correct answer, right? Now hot packs आमे केमती कौन करूँ बेटा? This is with the help of gel or clay that is heated, and that moisture contribute to the heat transfer forces, right? So option B is the correct answer. Therefore, hot packs are considered a form of moist heat application, not dry heat. So option B is the correct answer, right? Next question, question number 301. Which needle stick injury may cause infection to healthcare provider except option A HIV, option B HBV, option C SCV, and option D malaria. So which option is the correct answer, beta? Which needle stick injury may cause infection to healthcare provider except option A HIV, option B HBV, hepatitis B virus, option C hepatitis C virus, and malaria. So which option is the correct answer? Which needle stick injury may cause infection to healthcare provider except malaria? Right? Option D is the correct answer. Next question. The most appropriate nursing action to a depressed patient who does not want to join a group is to option A tell her the rules of the unit or that no client can remain in bed. Option B suggest the better get out of the bed or she will go hungry later. Option C tell her that the nurse will assist her out of bed and help her to address. Option D allow her to remain in bed unit. She feels ready to join the other client. So which option is the correct answer, beta? The most appropriate nursing action to depressed patient who does not want to join a group. So option D is the correct answer, right? Allow her to remain in bed and unit she feels ready to join the other client. So option D is the correct answer. Next question, question number 303. A patient is getting total parenteral nutrition. Patient is getting total parenteral nutrition TPN via central venous line. The infusion rate should monitor closely except a patient getting TPN, total parenteral nutrition, via central venous line. The infusion rates should monitor closely except option A to prevent oscillations in glucose profile, option B to prevent fluid overload, option C to prevent electrolyte imbalance, option D to prevent artery blockage. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option D, right? To prevent artery blockage. So beta TPN आमे कोथिरे दोचे administration in vein ना बेटा है ना नहीं TPN administer into a vein TPN administered into a vein माध्यम आमे दोचे ना not an artery, right? ना not an artery. राइट सो टू प्रिवेंट आर्टरी ब्लॉकेज दिस इज ये कुछ छाड़ेगी बाकी तक सब ठीक ठाक राइट टू प्रिवेंट ऑसिलेशन इन ग्लूकोज प्रोफाइल टू प्रिवेंट फ्लूइड ओवरलोड टू प्रिवेंट इलेक्ट्रोलाइट इम्बालांस ये सब आम क्लोजली मॉनिटर करछे कहा को छाड़ी टू प्रिवेंट आर्टरी ब्लॉकेज को छाड़ी राइट सो ऑप्शन डी इज द करेक्ट आंसर बेटा नेक्स्ट क्वेश्चन क्वेश्चन नंबर 304 is what is the dopamine stimulating drug that stimulates the production of prolactin inhibitors factors resulting in a decrease in prolactin and stations of lactations. Option A domperidone, option B metoclopramide, option C bromocriptine, option D oxytocin. So which option is the correct answer, beta? So correct answer is option C, bromocriptine, right? Bromocriptine. So bromocriptine कौन कर बेटा डोपामिन स्टिमुलेटिंग ड्रग दैट स्टिमुलेट्स द प्रोडक्शन ऑफ प्रोलैक्टिन इनहिबिटर फैक्टर्स and resulting in decreased prolactin and cessation of lactation, right? Reduce करछे prolactin को and inhibits करछे बेटा cessation of lactation को, breast milk production को कौन करछे बेटा बंद कर दोछे, cessation of breast milk productions, right? Next question. Question number 305 रही बेटा. Which of the following drugs is mainly used to manage VRSA infections? VRSA infection option A रही vancomycin, option B telavancin, option C रही daptomycin, option D रही linezolid. So which option is the correct answer बेटा? VRSA. VRSA. VRSA कौन बेटा? Vancomycin resistant Staphylococcus aureus. Vancomycin resistant Staphylococcus aureus. VRSA. Which of the following drugs is mainly used to manage VRSA infections? Vancomycin and telavancin, option C is daptomycin, option D is linezolid. So which option is the correct answer beta? Correct answer is option A, vancomycin. Vancomycin is the primary drug used to manage infections caused by VRSA. Right? So option A is the correct answer. Next question. Question number 306. What is the drug of choice for giardiasis? What is the drug of choice for giardiasis? Option A is metronidazole, option B is cotrimoxazole, option C is penicillin, option D is piperacillin. So which option is the correct answer beta? Which option is the correct answer? So giardiasis beta, this is the intestinal infection caused by parasite Giardia lambelia. This is the intestinal infections. Intestinal infection. कहाँ जो हो जो बेटा? को parasite जो? Parasite. Which parasite? Which parasite बेटा? Giardia lambelia. Giardia lambelia. Right. So which option is the correct answer? Metronidazole, drug of choice for giardiasis, right? Option A is the correct answer. Next question, question number 307. Calculate the drip rate for 100 ml of normal saline to be administered over half an hour through a set that delivers 10 drops per ml. Option A 10 drops per minute. Option B is 10 drops per minute. Option B is 15 drops per minute. Option C is 30 drops per minute. Option D is 33 drops per minute. So which option is the correct answer बेटा? हमें ऑलरेडी हमें कैलकुलेशन पे फॉर्मूला कही सारी केमती कैलकुलेट करा जाए. फॉर्मूला होची बेटा ड्रिप रेट रा फॉर्मूला कौन बेटा? वॉल्यूम इन ml इनटू ड्रॉप फैक्टर और ड्रॉप फैक्टर है ना, और drop right by total times in minute, total time in minutes, right? So कितने देची बेटा? वॉल्यूम कितने देची? 100 ml. and drops कितने देची? 10 drops देची है ना. नहीं कितने समय? half an hour. कितने? हाफ एन आवर्स मीन्स कितने? 30 मिनट्स लता. 100 into 10 कितने बेटा? 1000 by 30. 1000 by 30 को डिवाइडेड कर कितने होगा बेटा? 33.33 होगा ना. नहीं 33.33 ड्रॉप्स पर मिनट है ना. नहीं So correct answer कौन होगा? Option D is the correct answer. Option D is the correct answer. माने रखता हो बेटा ये फॉर्मूला को ड्रिप rate equal to volume in ml into drop factors or drop divided by total time in minutes. Right, option D is the correct answer. Next question, question number 308. Which of the following is a sweetened fragrant solution of alcohol used a carrier of the therapeutic medicines? Which of the following is a sweetened fragrant solution of alcohol used a carrier of therapeutic medicines? Option A is powder, option B is elixir, option C is aqueous solution, option D is lotion. So which option is the correct answer beta? The correct answer is elixir beta. Option B is the correct answer, right? Option B is the correct answer. This is elixir is a sweetened fragrant solutions of alcohol and water that is used as a vehicle for medicinal substance, right? So option B is the correct answer. Next question, question number 309. What is the proper angle for subcutaneous injection using a half-inch needle? What is the proper angle of subcutaneous? What is the proper angle for subcutaneous injections using half-inch needle? Option A is 30 degree, option B is 45 degree, option C is 15 degree, option D is 90 degree. So which option is the correct answer? बेटा फटाफट आंसर कर दियो. बेटा हाफ इंच नेडल कही हाँ ठीक है भलते सोच समझ के आंसर करो. सबक्यूटानियस इंजेक्शंस यूजिंग हाफ इंच नेडल बेटा हाफ इंच नेडल तो से टिके सबक्यूटानियस इंजेक्शन देला बेले को एंगल रे दबो बट हाफ इंच नेडल यूज करिके सो बेटा 90 डिग्री हम राइट 90 डिग्री इज द करेक्ट आंसर. आम जाने बेटा 45 डिग्री रे दौचे अदरवाइज 90 डिग्री रे दौचे हाँ ना नहीं. लीन एंड थिन जो पतला लोक थे जब सबक्यूटानियस देवार अच्छे 45 डिग्री रे दौचे और बेसी फेट एरिया रे दौचे आम 90 डिग्री रे दौचे ना बेटा ये हाफ इंच निडल यूज करने कही तो 90 डिग्री हम करेक्ट आंसर. सो ऑप्शन डी इज द करेक्ट आंसर बेटा राइट. Option D is the correct answer. Next question, question number 310 अच्छी बेटा. Which one is the injection in dots program? Which one is the injection in dots program? Option A is streptomycin, option B is rifampicin, option C is isoniazid, option D is ethambutol. So which option is the correct answer? ethambutol भी ओरली नवाक पड़े, isoniazid भी ओरली नवाक पड़े, rifampicin भी ओरली नवाक पड़े. Dots ro full form कौन बेटा क्वेश्चन है dots ro full form. Dots ro full form. What is the full form of dots? Directly observed treatment माने रखे था बेटा short course. Right, dots ro full form most important MCQ आसुच बेटा. डॉट्स रो फुल फॉर्म भी पचारुची बेले बेले. डॉट्स रो फुल फॉर्म कोन डायरेक्टली ऑब्जर्व ट्रीटमेंट शॉर्ट कोर्स. सो करेक्ट आंसर कोन होबा बेटा ऑप्शन ए इज द करेक्ट आंसर राइट. दिस इज द इंजेक्टेबल ड्रग फॉर फर्स्ट लाइन tuberculosis medications used in dots streptomycins right. ऑप्शन ए इज द करेक्ट आंसर. डॉट्स रो फुल फॉर्म पचारुची बेटा मन रखी तो भूलिबो नाही. नेक्स्ट क्वेश्चन 311 अछि which of the following is not more common routes of parenteral administration of drugs? Which of the following is not more common routes of parenteral administration of drugs? Option A hypodermic, option B intramuscular, option C intravenous, option D sublingual. So which option is the correct answer? हाइपोडर्मिक कितने एंगल बेटा हाइपोडर्मिक 45 डिग्री एंगल देते हुए राइट इंट्रामस्कुलर केते डिग्री एंगल रे 90 डिग्री एंगल रे इंट्रावेनस कितने डिग्री एंगल बेटा 15 डिग्री टू 25 डिग्री एंगल and this is all about parenteral administration of drugs, right? Hypodermic, intramuscular, intravenous. But sublingual केमती दिया हुआ बेटा सबलिंगुअली टंग तले दिया होचे ना in emergency situations रे. So option D is the correct answer. Option D is the correct answer. So sublingual is not more common routes of parenteral administration of drugs, right? Is under the tongues, right? Next question number 312. What is the abbreviation of GTT? What is the abbreviation of GTT? Option A रचे liter, option B रचे milliliter, option C रचे gallon, option D रचे drop. GTT गुटाय कौन कहते गुटाय गुटाय GTT गुटाय. This is the Latin word beta GTT or gutai. This is the Latin word. So correct answer is drop. GTT means drop. Right. Next question number 313. If a child is ordered to be given 75 milligram of aminophylline intravenously and you have 250 milligram in 10 ml of the solution, how many milliliters will you administer? If a child ordered to given 75 milligrams मन रखना ना बेटा एटा भी मो कहिथिल गुटे फार्मूला. तो हम केते वॉल्यूम दबार अछि वॉल्यूम इक्वल टू फार्मूला अछि बेटा वॉल्यूम इक्वल टू केते वॉल्यूम जदि हमें दबार अछि ताले केमति बाहर करबा desired dose by what? Concentration or available in hand है ना नहीं बुझी पारला तो So answer करो बेटा फटाफट. Determine the concentration of solution. The solution has 250 milligram in 10 ml aminophylline. Right. So concentrations equal to 250 milligram by 10 ml equal to 25 milligram per ml है ना 25 milligram per ml concentration बाहर निकला. So volume equal to desired dose by concentration. So बाहर कर दे बे volume equal to desired dose कितने अच्छी बेटा 75 milligram है ना divided by कितने 25 milligram per ml equal to कितने हबो 3 ml हबो ना 3 ml. Very good. Option D is the correct answer. Option D is the correct answer. बेटा next question number 314 अच्छी बेटा जो मैंने लाइव देखो वीडियो को लाइक कर दियो शेयर कर दियो और जो मैंने फर्स्ट टाइम चैनल को देखो ताले निहाती भाव चैनल को सब्सक्राइब कर दियो. दिस इज माय हम्बल रिक्वेस्ट टू वन एंड ऑल. Please subscribe the channel and share the video, like the video. What is the application of medicines in intact skin called? Option A is subcutaneous, option B is topical, option C is intrathecal, option D is intraspinal canal. Sorry, intraspinal canal, right? So which option is the correct answer? फटाफट आंसर कर दिया. What is the application of medicine in intact skin called? Option which is subcutaneous, option which is topical, option C is intrathecal, option is intraspinal canal. So which option is the correct answer? Correct answer is topical, but topical route involves applying medication or treatment directly to the skin. That is topical route. Applying medication or treatment directly to the skin or mucous membrane. So option B is the correct answer, right? Next question number 315. What is cooking at low heat and minimum amount of liquid is called? What is cooking at low heat and minimum amount of a liquid called? Option is poaching, option which is stew, option C is pressure cooking, option D is steaming. So which option is the correct answer? So correct answer is poaching. Poaching is a most moist method of cooking in which food is placed in liquid which brought to and maintained at a temperature just under boiling point. Beta, right? So कौन कौन हमें करूचे ना cooking liquid like water, milk, माना नहीं. So option A is the correct answer. Next question number 316. In the context of drug administration, what does QID stand for? QID मैंने कौन बेटा? QID water in dye, है ना नहीं? Water in dye. QID रो full form water in dye. तो आम लैटिन भाषा कहले क्वार्टर इन डाई है ना नहीं. तो यार माने कौन बेटा आम जो ड्रग एडमिनिस्ट्रेशन करुचे पेशेंट पाई QID यदि ऑर्डर कर दिए डॉक्टर्स पळेले ताहले आमे केते थर देबा पेशेंट को? once a day, 4 times a day, 3 times a daily, 6 times a day. So which option is the correct answer? फटाफट आंसर कर दियो को माने आंसर करिछो. So Pradipta Gowda, option B, Kamala Bhatra, option B, Sonalika, option B, Crazy Boys, option B, Mamata Nag, option B, Rachana Gowda, option B. Very good. 4 times a day is the correct answer. Option B is the correct answer. Next question number 379. Example of adjuvant analgesic therapy for pain management is DS. Option A, partial agonist, option B, non-salicylate, option C, mixed agonist, antagonist, option D is GABA receptor agonist. So which option is the correct answer? So correct answer is beta option D, GABA receptor agonist. So it is an example of adjuvant analgesic therapy for pain management, that is GABA receptor agonist. So option D is the correct answer. Next question number 318 is which of the following tissue inflammation is treated by administering the drug balsalagide? Which of the following tissue inflammation treated by administering the drug balsalagide? So option is olfactory mucosa, option B is venereal mucosa, option C is renal mucosa, option D is bowel mucosa. So which option is the correct answer? Which option is the correct answer, beta? So correct answer is option D, bowel mucosa is the correct answer. Balsalized is an anti-inflammatory drug, where this is the anti-inflammatory drugs. Anti-inflammatory drugs that is primarily used to treat inflammatory bowel disease. It is primarily used for inflammatory bowel disease, IBD, inflammatory bowel disease by use karadai balsalagides, right? So correct answer kan hama this drug helps to reduce inflammation of the inner lining of the large intestine, right? So correct answer kan hama beta bowel mucosa haba. Option D is the correct answer. Next question number 319. What is the mechanism of action of amiodarone? What is the mechanism of action of amiodarone? Very important MCQ beta. Option is calcium channel blocker, option which is sodium channel blocker, option C is beta adrenergic receptor blocker option D is class third antiarrhythmic drugs. So correct answer is beta option D, class third antiarrhythmic drugs beta. Right? SVT supraventricular tachycardia patient मान को दिया हुआ बेटा amiodarone, right? Supraventricular tachycardia. So class third antiarrhythmic drug, right? This is the mechanism of action of amiodarone, that is class third antiarrhythmic drug. Right now beta. Ventricular arrhythmia, right? Ventricular arrhythmia रे दिया होची. Life threatening ventricular arrhythmia रे दिया होची बेटा. Otherwise patients ठूस ही otherwise patient ऊपर को पार है जब supraventricular tachycardia रे दिया होची बेटा. जितने fast irregular heartbeat हो, fast and irregular heartbeat होची. से समय आम पेशेंट को रिवॉर्ड करने नॉर्मल हार्ट रेट को आने दौचे एमियोडारोन, राइट? नेक्स्ट क्वेश्चन नंबर 320 रही बेटा. द इफेक्ट ऑफ सिंगल डोज ट्राइमटेरेनी लास्ट फॉर हाउ मेनी आवर्स? द इफेक्ट्स ऑफ सिंगल डोज ऑफ triamterene last for how many hours? Option is 12 to 16 hours. Option B is 18 to 20 hours. Option C is greater than 20 hours. Option D is 6 to 8 hours. Triamterene. So the effects of single dose of triamterene last for 12 to 16 hours. 12 to 16 hours. So triamterene has been rapidly absorbed from the gastrointestinal tract beta, right? So then its action occurs within 2 to 4 hours of oral administration, right? And its duration of action is 12 to 16 hours, right? So triamterene diuretic effect achi beta, diuretic effect achi, right? Diuretic effect of triamterene and may not be seen until several days after the administration. So 12 to 16 hours je काम करेगा बेटा. Next question number 321 achi. Which symptoms suit the nurse assess when a patient receives loop diuretic? Option achi increased blood pressure and muscle spasm. Option B achi paresthesis and irritability. Option C is restlessness and agitation. Option D is weak irregular pulse and poor muscle tone. Which symptoms should the nurse assess when a patient receives loop diuretics? फटाफट आंसर कर दो बेटा, फटाफट आंसर कर दिया. Increased blood pressure and muscle spasm. Option B is paresthesis and irritability. Option C is restlessness and agitation. Option D is weak irregular pulse and poor muscles tone. So which option is the correct answer? So correct answer option D है बेटा. Option D is the correct answer. Option D is the correct answer है. Weak irregular pulse and poor muscle tone है बेटा. When the patient receive loop diuretics, which symptoms should the nurse assess? Irregular pulse है, weak and irregular pulse है ना नहीं, and poor muscle tone देखा जीवा. Because due to hypovolemia, कौन पे होची बेटा? hypovolemia होची. So loop diuretics कौन होची बेटा? reduce potassium level, right? Reduce potassium level. So loop diuretic देला बेले हमको पोटेशियम, सेरम पोटेशियम को मॉनिटर करने को पड़े. सेरम पोटेशियम को मॉनिटर करने को पड़ेगा बेटा. जैसे लोग when patient receive loop diuretics, we monitor serum potassium level. because loop diuretics can't करवा बेटा it can reduce potassium level in the body है ना नहीं और एटा essential for the functioning of the heart and muscles है ना नहीं से भाई मसल पुअर मसल टोन हो जाउची irregular and weak pulse हो जाउची है ना नहीं so option D is the correct answer. Next question, question number 322 रचे which drug is used for the treatment of anemia associated with renal failure? Option A रचे erythropoietin, option B रचे interleukin, option C रचे ferrous sulfate, option D रचे iron dextran. So which option is the correct answer? बेटा फटाफट आंसर कर दिया. So correct answer is option A. Option A is the correct answer. Very good. Option A is the correct answer बेटा. So anemia को treat करवा पाए हमें erythropoietin दो है ना नहीं right ना बेटा. So erythropoietin is used for the treatment of anemia associated with renal failure. Renal failure हला पर नहीं कि patient गुड़ा का anemia है जानते बेटा. And this is the hormone which is produced by the kidney and controls the production of red blood cells, right? So erythropoietin is important drug for the treatment of anemia associated with renal failure. Option A is the correct answer. Next question, question number 323. A concentrated solution of sugar containing the drug to mask the bitter taste of the drug is called option A suspension, option B emulsion, option C syrup, and option D mixture. So which option is the correct answer, beta? Very good. Option C is the correct answer, right? Syrup. A concentrated solution of sugar containing the drug is to mask the bitter taste of the drug is called syrup, right? Option C is the correct answer. Next question, question number 324. Which route of exposure presents the highest risk for nurses handling chemotherapy drugs? Option A mucous membrane, contact. Option B inhalation of aerosols and thermal absorption. Option C ingestion. Option D injection. So which option is the correct answer बेटा? फटाफट आंसर कर दियो. So correct answer is option B, inhalation of aerosol and thermal absorptions, right? Option B is the correct answer बेटा. Which route of exposure presents the highest risk of nurses handling chemotherapy drugs, that is inhalation of aerosols and thermal absorptions. So option B is the correct answer. Next question, question number 325. Rachi. Drugs that relieves indigestion and heartburn by neutralizing stomach acids are known as option D analgesics, option B antacids, option C antiemetics, option D antipyretics. So which option is the correct answer? फटाफट आंसर कर दिया. Drugs that relieve indigestion and heartburn by neutralizing stomach acids are known as option A analgesics, option B antacids, option C antiemetics, option D antipyretics. So which option is the correct answer? Very good. Option B is the correct answer, antacids. Right, antacids is the correct answer beta. Next question, question number 326. Which of the following drugs is a common example of serotonin and norepinephrine reuptake inhibitors, SNRIs? Option A fluoxetine, option D duloxetine, option C is paroxetine, option D is sertraline. So which option is the correct answer beta? Psychiatric question, psychiatric drug, psychopharmacology beta. So correct answer is beta duloxetine. This is SNRI drugs beta. Duloxetine is a well-known serotonin and norepinephrine reuptake inhibitors beta. And these drugs increase the level of both serotonin and norepinephrine in the brain, right? And relieve the symptoms of depressions and relieve the symptoms of the depression. Relieve the symptoms of depression beta. Symptoms of depressions and anxiety, right? And certain chronic pain. Right, next question number 327. A child admitted after ventriculoperitoneal shunt, each receiving 60 ml per hour normal saline via microdrip set. How much drop rate is required to meet the fluid requirement of the child? Right, a child admitted after ventriculoperitoneal shunt is receiving 60 ml per hour normal saline via microdrip set. How much drop rate is required to meet the fluid requirement of the child? Option A 40 drops per minute, option B 60 drops per minute, option C 80 drops per minute, option D 10 drops per minute. So which option is the correct answer beta? Which option is the correct answer? So child केते fluid receive करछि बेटा 60 ml per hour है ना नहीं ड्रॉप फैक्टर हम यदि कैलकुलेट करबा माइक्रो ड्रिप सेट ड्रॉप फैक्टर इक्वल टू माइक्रो ड्रिप सेट नहीं तो माइक्रो ड्रिप सेट रो ड्रॉप फैक्टर केते बेटा 60 drops per ml, right ना? So micro drip set delivers 60 drops per ml है ना नहीं? So एबे हमें देखियो बेटा जो how much drop rate is required to meet the fluid requirement of the child हमें ताको बाहर करबा. So calculate the total drops per hour. Total drops per hour. So हमें कौन करबा multiply the volume per hour by the drops per ml total drops per hour. So 60 ml into 60 drops है ना 60 ml into 60 drops equal to कितने हेगला बेटा 3600 drops per hour हेगला है ना नहीं. So एबे हमें drops per minute रे हमें यदि calculate करिबा drops per minute यदि हमें देखिबा so divide the total drops per hour by 60 minute in a hour है ना 60 minute in a hour. So हमें drops per minute यदि हमें बाहर करिबा drops per minute यदि हमें बाहर करिबा केते बेटा 3600 drops per hour. This is drops per hour divided by 60 minutes per hour है ना नहीं per hour तो कहते हैं जो बेटा 3600 divided by 60 ही गले 60 drops per minute ही जो 60 drops per minute ही जो आंसर right. So correct answer is 16 drops per minute. Option B is the correct answer beta, right? 16 drops per minute is the correct answer. Next question number 328 अछि beta. A nurse is caring for a patient on warfarin therapy with an INR or international normalized ratio of 5.6. Which medications should be administered? Option A vitamin K, option B रची protamine sulfate, option C रची fresh frozen plasma, option D रची heparin. So which option is the correct answer beta? Correct answer is vitamin K, right? So INR कितने अच्छी बेटा 5.6 5.6 for a patient on warfarin therapy. So elevated risk of कौन होगा बेटा? Elevated risk of bleeding होगा. Elevated risk of bleeding हबर chance दिसुची, right, due to INR 5.6 अछि. So हमको कौन करवार अछि? Appropriate medication administration करिवार अछि, that is vitamin K, right? Vitamin K हमको दवा को पड़िबो. Option A is the correct answer. Next question, question 329 रे अछि. Calculate the drop per minute if a nurse wants to administer intravenous IV fluid at a rate of 60 ml per hour using a micro drip set. So फटाफट आंसर करो बेटा, आंसर करो पूर्ण हरण करिक. वॉल्यूम ऑफ फ्लूइड कितने बेटा? वॉल्यूम ऑफ फ्लूइड कितने अच्छी बेटा? 60 ml अच्छी, हाँ ना? नहीं 60 ml अच्छी. तो सो टाइम इन आवर्स आम ताको जदि मिनिट रे कले केते हबो? 60 मिनिट हबो, हाँ नहीं? टाइम इन आवर्स 1 आवर्स पर आवर्स आम जदि कैलकुलेट करछु, टाइम इन 1 आवर्स ना पर आवर्स इक्वल टू केते? 60 मिनिट, हाँ ना? नहीं. सो फॉर माइक्रो ड्रिप सेट केते बेटा? फ्लो रेट और ड्रॉप फैक्टर्स माइक्रो ड्रिप रो फ्लो रेट केते और ड्रॉप फैक्टर केते? 60 GTT पर मिनट, 60 ड्रॉप्स पर मिनट, हाँ ना? नहीं. सो ड्रॉप इक्वल टू केते? वॉल्यूम बाय टाइम in minute, volume by time in minute equal to into 60. है ना? ड्रॉप फैक्टर भी अच्छी ना, टोटल वॉल्यूम into ड्रॉप फैक्टर्स by टोटल टाइम इन मिनट, है ना? नहीं. सो कहते 60 into 60 डिवाइडेड बाय कहते 1 आवर इक्वल टू कहते 60 मिनट. 60 सो कहते है जो बेटा 60 ड्रॉप्स पर मिनट है. So correct answer is option D. Very good. Option D is the correct answer. Next question, question number 330. In context to NABH laws stand for option A. Look, most important MCQ, most important. बेटा जो ड्रॉ कैलकुलेशन आम करले से ड्रॉ कैलकुलेशन एग्जामिनेशन रे मन रखता से भले भाव रे ड्रॉ कैलकुलेशन करबा. सो क्वेश्चन नंबर 330 रचे. इन कंटेक्स्ट टू NABH laws stand for. NABH रो फुल फॉर्म कौन बेटा? नेशनल एक्रेडिटेशन बोर्ड फॉर हॉस्पिटल एंड हेल्थ केयर प्रोवाइडर्स. जाने छना बेटा NABH रो फुल फॉर्म? NABH जाने छना? नहीं सब पढ़ी छना बेटा ना, भूली भूला गलनी. नेशनल एक्रेडिटेशन board for hospitals and healthcare providers This is the full form of NABH, right? LASA stand for look alike and soft alike. Option B is look alike and sound alike. Option C is live alike and stand alike. Option D is liquid alike and solid alike. So which option is the correct answer? So correct answer is option B. Very good. Option B is the correct answer. Look alike and sound alike. Like. So correct answer कौन है बेटा? Option B is the correct answer. Right, next question देखिए. Question number 331 अछि. The patient with following disease condition, the drug etomidate is ideally used for general anesthesia. Option A अछि ortho problems. Option B अछि neuro problems. Option C अछि gastrointestinal problems. Option D अछि cardiovascular problems. So which option is the correct answer beta? So question कौन अछि? The patient with following disease condition, the drug etomidate is ideally used for general anesthesia. It is for ortho problems, neuro problems, gastrointestinal problem, cardiovascular problems. So correct answer is beta option D, cardiovascular problem. Right. Next question, question was 332. 1 teaspoon contains dash ml. ऑप्शन डी 2 ml, ऑप्शन बी 5 ml, सी ऑप्शन सी 10 ml, ऑप्शन डी 15 ml। फटाफट आंसर कर दो बेटा, फटाफट आंसर करो फटाफट। They want to know your answer. So which option is the correct answer बेटा? 1 teaspoon contains DSML, 1 teaspoon contains DSML। बेटा जो मैंने पर्यंत वीडियो को लाइक करना, वीडियो को लाइक कर दिया, इट्स माय रिक्वेस्ट टू वन एंड ऑल। जो मैंने वीडियो को लाइक करना, वीडियो को लाइक कर दिया एवं शेयर कर दिया एवं चैनल को जो मैंने फर्स्ट टाइम देखु चाहती, प्लीज 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 सब्सक्राइब द चैनल, राइट। So which option is the correct answer? 1 teaspoon contains DSML. 1 teaspoon contains DSML. Very good option. V is the correct answer. 5 ml. 1 teaspoon contains 5 ml. Right. Next question, question number 333. During home visit, which of the following drugs will be given by community health nurse into reduce fever? Option A tablet Septran, option B tablet paracetamol, option C syrup Gelusil, option D tablet Folifair. So which option is the correct answer beta? समझता हूँ जोड़ा नहीं कि ऑप्शन बी इज द करेक्ट आंसर, टैबलेट पैरासीटामोल। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 334। व्हिच ऑफ द फॉलोइंग ड्रग्स इज एन अल्फा ब्लॉकर? व्हिच ऑफ द फॉलोइंग ड्रग्स इज एन अल्फा ब्लॉकर? ऑप्शन ए प्रोपानोलोल, ऑप्शन बी नेफिडिपिन, ऑप्शन सी वेरापामिल, ऑप्शन डी प्रोजेस्टिन। सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? So alpha blockers is a medication class of medication that relax blood vessels by blocking alpha adrenergic receptors, right? So which option is the correct answer? Correct answer is beta option D, prazosin. Prazosin is the correct answer beta. Prazosin is an alpha blocker. This is an alpha blocker. Prazosin, dexazosin, ये सब सेम ग्रुप ऑफ ड्रग्स बेटा। डेक्साजोसिन, प्राजोसिन, टेराजोसिन, right? These all are the alpha blockers group of drugs. Next question, question number 335 to beta. Which of the following is a methylxanthine group of bronchodilators? Which of the following is a methylxanthine group of bronchodilators? Option A terbutaline, option B aminophylline, option C salmeterol, option D hypertropium. So which option is the correct answer? Which of the following is a methylxanthine group of bronchodilators? Terbutaline, aminophylline, salmeterol, option D hypertropium. So which option is the correct answer? So correct answer is beta aminophylline, option B is the correct answer. So aminophylline is bronchodilators है ना, methylxanthine group of bronchodilators and used to treat condition such as asthma and COPD. Asthma and COPD रे यूज करा जाए, asthma and COPD. COPD रा फुल फॉर्म कौन? Chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease COPD. Asthma and COPD रे यूज करा होचे ହେଲା aminophylline. Next question, question number 336. Which of the following is the action of diltiazem? Which of the following is the action of diltiazem? Option is stimulants, option B calcium channel blockers, option is beta blockers, option D is sedative and hypnotic. So which option is the correct answer? Which option is the correct answer? आंसर कर दो फटाफट। So correct answer is beta option B, calcium channel blockers. Option B is the correct answer. Calcium channel blockers is the action of diltiazem. So diltiazem used for treat hypertension, angina pectoris, right? Treat for hypertension, angina pectoris, ଆଉ କ'ଣ ପାଇଁ ୟୁଜ୍ ହେଉଛି ବେଟା and sometimes of arrhythmia ରେ ୟୁଜ୍ କରାହେଉଛି arrhythmia right. Next question number 337 is what is the drug of choice for leprosy? What is the drug of choice for leprosy? Option A is chloroquine, option B is primaquine, option C is dapsone, option D is rifampicin. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दियो, फटाफट आंसर कर दियो बेटा. Very good. Correct answer is dapsone. The drug of choice for leprosy is dapsone. Dapsone is used in the treatment of leprosy. Option C is the correct answer beta. Most important MCQ. Right, most important MCQ. मन रखियो पड़ेगा. So leprosy को और कौन कहते बेटा? Hansen's disease. Hansen's disease. Leprosy is otherwise known as Hansen disease. Right, next question number 338 beta. The nurse working in a pre-operative unit was caring for a patient with cataract and observed an order of the eye drops atropine OS every hour. What do you mean by OS? Option is right eye, option B is both eye, option C is left eye, option D is unaffected eye. So which option is the correct answer? Most important MCQ. Most important MCQ 5 star दे दो बेटा, 5 star दे दो. The nurse working in pre-operative unit was caring for a patient with cataract and observed an order of the eye drops atropine OS every hour. What do you mean by OS? Right eye, both eye, left eye, unaffected eye. So which option is the correct answer? Correct answer is beta option C, left eye. So OS ର full form କ'ଣ ବେଟା? OS ର full form oculus sinister. Right, OS ର full form है oculus sinister and OS abbreviation of eye drops. It refers to the left eye beta. OS, which means left eye. And atropine eye drops कौन पे यूज करा हुआ बेटा? Atropine eye drops. Atropine eye drops used to dilate. It used to dilate. What? To dilate the pupil. Dilate the pupil. And relax the eye muscles and relax the eye muscles. Relax the eye muscles before an eye examination or surgery. हाँ ना नहीं? The OS means oculus sinister, that is left eye, and OD means oculus dexter. Oculus dexter, that is right eye. Right eye. Right, OD means oculus dexter, right eye. OS means oculus sinister, left eye. माने रखे था बेटा. Next question. Question number 339 is what is the meaning of PRN order in medicines administration? What is the meaning of PRN order in medicines administration? Option A is post meal, before sleep. Option B is administered immediately. Option C is when required. Option D is single administration. So which option is the correct answer? Which option is the correct answer बेटा? फटाफट आंसर करो. So correct answer is option C. PRN stand for proprenata. PRN full form कौन बेटा? Prorenata. Prorenata. No, this is the all Latin phrase. And PRN means when required or when necessary. When required or when necessary. When necessary, when needed. Right? So option C is the correct answer. But next question. Question number 340. The doctor advised injection of ceftriaxone 500 mg IV to a patient. The available stock strength is 1 gram per 5 ml. How much volume of drug should the nurse administer to the patient? Option A 1 ml, option B 5 ml, option C 2.5 ml, option D 10 ml. So which option is the correct answer, beta? Which option is the correct answer? Stock strength कितने बेटा 1 gram per 5 ml है ना डॉक्टर प्रेस्क्राइब कितने करछन्ते 5 मिलीग्राम डॉक्टर प्रेस्क्राइब कितने करछन्ते एडवाइस करछन्ते 5 मिलीग्राम हम पाखरे स्टॉक्स कितने अछि 1 gram per 5 ml है ना सो 1 gram इक्वल टू कितने बेटा कितने मिलीग्राम 1000 मिलीग्राम है ना तो 1000 मिलीग्राम 5 ml रे 1000 मिलीग्राम अच्छी 5 ml 1 gram per 5 ml है ना so 1000 मिलीग्राम इक्वल टू 5 ml है ना कहते हो बेटा आंसर फटाफट आंसर करो तो हम जो रेशियो बाहर करो बेटा 1000 is to 5 ml है ना इक्वल टू कहते बेटा 5000 मिलीग्राम पर इंटू 1 ml दैट इज एक्स धरो है पहले कितने जो बेटा 500 into 5 by 1000 x कितने 2.5 ml so option C is the correct answer beta 1000 divided by 5 ml equal to 500 milligram into ml required ml right so 500 into 5 divided by 1000 equal to 2.5 ml hour right so correct answer कितना होगा बेटा option C is the correct answer right option C is the correct answer very good next question number 341 an agent that is used to stop bleeding is option A anticoagulants option B styptics option C hemantinics option D astringents so which option is the correct answer beta so correct answer is option B styptics this is an agent to stop bleeding is called beta styptics is an agent used to stop bleeding that is styptics and styptics is a substance that helps to stop bleeding right option B is the correct answer next question number 342 which of the following drugs is a bacteriostatic agent option A is streptomycin option B is ethambutol option C is isoniazid option D is rifampicin bacteriostatic agent so option B is the correct answer ethambutol is a bacteriostatic agent beta and it inhibits the growth of mycobacterium tuberculosis, right? Option B is the correct answer. Next question, question number 343 rachi beta. Ceftriaxone sodium 1 gram in 15 ml normal saline NS is to be administered over 30 minutes to a client with an infections. The drop factor is 15 drops GTT for 1 ml. The nurse sets the flow rate how many drops per minute. Option B 22 drops per minute, option B 25 drops per minute, option C 28 drops per minute, and option D 30 drops per minute. So which option is the correct beta? आम जानी बेटा फ्लो रेट केमती कैलकुलेशन करवा, दैट इज जीटीटी पर मिनिट है ना, नहीं इक्वल टू टोटल वॉल्यूम इन ml into drop factors divided by total time in minutes, right? So which option is the correct answer? So 50 ml into 15 drops factor दी 15 drops है ना, नहीं divided by कितने 30 minutes है ना, नहीं divided by 30 minutes कितने ऐसे हो बेटा? सेवन 50 by 30 कितने हो बेटा? 25 हो ना. So correct answer is option B. Option B is the correct answer. Very good. Next question, question number 344 is beta. Smallest syringe size of first use of central venous access device is. Smallest syringe size of first use of central venous access device is. Option is 5 ml, option is 1 ml, option is 2 ml, option is 10 ml. So which option is the correct answer beta? फटाफट आंसर कर देलो. So correct answer कौन होगा? 10 ml है वो. So smallest syringe size of first use of central venous access devices, that is CVAD, central venous access devices is 10 ml. Option D is the correct answer, right? Next question, question number 345. Furosemide injections is administered to a patient for which actions? Option A loop diuretics to prevent excessive fluid volume. Option B acts as AC inhibitors. Option C prevents gastric movement. Option D is a thiazide diuretic. So which option is the correct answer? Loop diuretic to prevent excess fluid volume. Option B acts as a AC inhibitors. Option C prevents gastric movements. Option D is a thiazide diuretics. So which option is the correct answer beta? Correct answer is option A. Furosemide injection is a loop diuretic beta, right? And it prevents excessive fluid volume. So option A is the correct answer, right? Next question, question number 346. An asthma patient comes to emergency with complaints of wheezing and chest pain. What should be the flow rate of oxygen for this patient? Option A 21. So the option A is 2 liter per minute. Option B is 5 liter per minute. Option C is 10 liter per minute. Option D is 15 liter per minute. So which option is the correct answer beta? So correct answer is option A beta, option A, 2 liter per minute, right? So आमे कोथरे दवा बेटा या को oxygen where nasal cannula can be sufficient, right? So आमे nasal cannula माध्यम रे दवा nasal cannula माध्यम रे ऑक्सीजन प्रोवाइड करेगा को पेशेंट्स को wheezing and chest pain patients को, right? And what should be the flow rate of oxygen for this patient? 2 liter per minute, right? And this is a case of asthma patient, right? Now next question beta. Question number 347. Desired dose of morphine for a patient is 0.4 milligram. Dose available is 1 milligram per ml. The correct formulation for this patient is option A 0.4 ml, option B is 0.8 ml, option C is 0.2 ml, option D is 0.3 ml. So which option is the correct answer beta? So desired dose कितने अच्छे बेटा? Desired dose equal to 0.4 milligram. है ना नहीं? So available dose कितने अच्छी? Available concentration और available dose कितने? हम पकड़े 1 milligram per ml अच्छी. आना नहीं? So हम यदि हमें आंसर बनेगा कौन आसे बेटा? Volume equal to desired dose by available dose in hand. आना नहीं? So कितने कितने अच्छी बेटा? 0.4 divided by 1 milligram per ml, right? तो कितने आंसर आसेगा बेटा? 0.4 ml आसेगा, right? 0.4 ml आसेगा. मैं तो कैलकुलेट करके बाहर करेगा. 0.4 ml आसेगा. करेक्ट आंसर option A is the correct answer. Next question number 348 अछि. For a patient the desired dose of a drug is 200 milligram BD. The available dose of this drug is 0.1 gram. The correct dose is for one dose of this drug is option A 1 tablet, option B 2 tablet, option C 3 tablet, option D 4 tablet. So which option is the correct answer beta? Desired dose अछि beta. Desired dose होची केते 200 milligram है ना नहीं? Available dose or per tablet available dose or per tablet कितने बेटा? 100 milligram है ना नहीं? So number of tablets यदि हम बाहर करवा number of tablets बाहर करवा किमती बेटा? Desired dose by available in hand छोटा, so 200 divided by 100 milligram per tablet. So कितने आसेगा बेटा? 2 आसेगा है ना? So correct answer is number of tablet is 2 tablets. Option B is the correct answer. Next question number 349 अछि बेटा. The flow rate of a drug is shown as 15 ml in 15 minutes. The correct flow rate of this drug is option A 150 ml per hour, option B 50 ml per hour, option C 200 ml per hour, option D 100 ml per hour. So which option is the correct answer बेटा? फटाफट आंसर कर दिया. आंसर बनाओ बेटा, फटाफट आंसर करो. फ्लो रेट बाहर करो बेटा, फ्लो रेट फटाफट. सो कितने वॉल्यूम अच्छी बेटा? 50 ml into flow rate of drug is 50 ml in 15 minutes. The correct flow rate of this drug is the flow rate of drug is shown as 15 ml in 15 minutes. The correct flow rate of this drug is 15 ml per hour. कितने आसो बेटा करेक्ट आंसर ऑप्शन सी इज द करेक्ट आंसर वेरी गुड ऑप्शन सी इज द करेक्ट आंसर 55 15 मिनट इंटू 60 हाँ ना नहीं 50 into 4 equal to 200 right so 200 our correct answer option C is the correct answer beta right option C is the correct answer next question number 350 what is the content of the injection lysis option B रचे potassium option C levofloxacin option C furosemide option D रचे metformin so which option is the correct answer beta फटाफट आंसर कर देला आंसर करो बेटा फटाफट वेरी गुड option C is the correct answer furosemide what is the content of the injection lysis that is furosemide beta next question number 351 है बेटा which of the following laws is related to the criteria for orally active drugs option है Nagel's rules 9 option B है Monroe-Cayley doctrine option C है Lipinski rule 5 option D है Cox postulates so which option is the correct answer so correct answer is beta Lipinski rule 5 right next question number 352 in a medication chart the nurse noted 1 gram of cefoperazone tablet BD for a patient the available drug dose is 500 milligram per tablet how many tablets should be given to the patient for a single night dose ये टाइप रो MCQ आसीओ बेटा कितना टेबलेट दवा को पड़ियो बोली पचारिबा राइट हम ऑलरेडी डिस्कशन कर सारलेनी तो फटाफट आंसर कर दियो बेटा so correct answer is option A होगा बेटा right option A is the correct answer so 1 gram cefoperazone tablet BD for a patient दिया है ना हमारे पास अवेलेबल कितने अच्छी 500 अच्छी हाँ ना नहीं 500 मिलीग्राम 1 tablets हाँ ना नहीं 2 tablets ले बेटा 1 gram हवा ना 2 tablets equal to 1 gram 1000 milligram और 1 gram हाँ ना नहीं so option A is the correct answer next question number 353 रचे the abbreviation AC used in prescription means option रचे after meals option B रचे before meals option C रचे at night option D रचे at evening so which option is the correct answer beta antecedent AC means antecedent है ना नहीं antecedent माना अच्छे ना बेटा ना भूल गलोनी AC means antecedent which is before meals है ना नहीं before meals which means before meals so which option is the correct answer option B is the correct answer before meals option B is the correct answer next question number 354 glimepiride is an example of dash option है meglit sulfonylureas so which option is the correct answer so correct answer is sulfonylureas so glimepiride माध्यम रे हमें कौन करू बेटा it is used in the treatment of diabetes it is used in the treatment of diabetes है ना नहीं glimepiride दिया हुआ है ना डायबिटीज पेशेंट को and this is belongs to the sulfonylurea class right this is the sulfonylurea class of drugs and it increase the secretion of insulin in the pancreas. It increase the secretions. It increase the secretion. It increase the secretion of insulin in pancreas, right? Next question number 355. What is the action of the sitagliptin? What is the action of the sitagliptin? So option A anti-diabetic, option B anti-hypertensive, option C anti-arrhythmics, option D cardiac glucoside. So which option is the correct answer, beta? Correct answer is option A, anti-diabetic. Right? So anti-diabetic is the action of sitagliptin, right? So sitagliptin is a oral anti-hyperglycemic medications, right? Oral anti-hyperglycemic medicines. Next question number 356. Which is the drug of choice to convert paroxysmal supraventricular tachycardia, PSVT? Which is the drug of choice to convert paroxysmal supraventricular tachycardia to normal sinus rhythm? Option A dopamine, option B adenosine, option C atropine, option D adrenaline. So correct answer is beta option B, adenosines. Adenosine माध्यम रे भी हमें PSVT को नॉर्मल साइनस रिदम रे कन्वर्सन करछि, हा ना नहीं रिवर्ट करछि पेशेंट को. PSVT paroxysmal supraventricular tachycardia, right? Adenosine माध्यम रे हमें नॉर्मल साइनस रिदम को आणुछि. नेक्स्ट क्वेश्चन नंबर 357. व्हाट इज द एंटीडोट फॉर डोपामिन? What is the antidote for dopamine? फटाफट आंसर कर दे बेटा. What is the antidote for dopamine? ऑप्शन ए डोपामिन, ऑप्शन बी फेंटोलामिन, ऑप्शन सी एपिनेफ्रिन, ऑप्शन सी नॉरएपिनेफ्रिन. So which option is the correct answer, बेटा? The correct answer is बेटा फेंटोलामाइन. So option B is the correct answer. So फेंटोलामाइन is the antidote for dopamine. Most important MCQ माना रखिता बेटा. Next question number 358 is during IV administration, which of the following drug causes extravasation and damage to site? Which drug or during IV administration, which of the following drug causes extravasations and damage to sites? Option A diazepam, option B epinephrine, option C phenytoin, option D ranitidine. So which option is the correct answer? So correct answer is beta option C, phenytoin. During IV administration of phenytoin injection, it causes extravasations and damage to the injection site. Ananai. phenytoin को और कौन कहते बेटा? phenytoin is known as the cause condition called purple glove syndrome, बेटा. purple glove syndrome माने रखे था purple glove syndrome. phenytoin to cause a condition called purple globe syndrome, right? Purple globe syndrome. Next question number 359. Which neurotransmitter axis can be associated with amyotrophic lateral sclerosis? Option A histamine, option B dopamine, option C serotonin, option D glutamate. So which option is the correct answer, beta? The correct answer is beta option D, glutamate. So excess of glutamate, it can be associated with amyotrophic lateral sclerosis, right? Amyotrophic lateral sclerosis, ALS. Excess of glutamate or excess of glutamate neurotransmitter can be associated with amyotrophic lateral sclerosis, right? Next question, question number 360 अछि beta. Which of the following is the test used to monitor warfarin therapy? Most important MCQ. Again, एक क्वेश्चन से हम डिस्कशन करूचे. पूर्व क्लास रे हम डिस्कशन ऑलरेडी कर सारिचे. Which of the following is the test used to monitor warfarin therapy? फटाफट आंसर कर दे बेटा. करेक्ट आंसर है ऑप्शन ए INR. INR international normalized ratio. INR international normalized ratio. International normalized ratio. No. Option A is the correct answer. Next question, question number 361. What is the antidote used for digoxin toxicity? What is the antidote used for digoxin toxicity? Most important MCQ beta. Most important MCQ. Paper questions also most important. This question also most important, right? What is the antidote used for digoxin toxicity? Option A is dopamine, option B is dulcolax, option C is dobutamine, option D is dizivant. So correct answer is beta dizivant. Option D is the correct answer. So antidote for digoxin poisoning or digoxin toxicity, dizivant or digoxin immunofeb भी कहते हैं को. कौन कहते बेटा? digoxin immunofeb. Dizivant कहते और digoxin immunofeb भी कहते, right? So option D is the correct answer. Next question, question number 362. Which of the following options is associated with Young's rules? Which of the following options is associated with Young's rules? Option A is management of burns, option B is management of cleft lip, option C is pediatric drug dosage, option D is protein energy malnutrition. So which option is the correct answer? So correct answer beta pediatric drug dosage haba, right? So Young's rule माध्यम रे हमें calculate करूचे pediatrics drug dosage है ना नहीं. We calculating pediatric drug dosage है ना नहीं. With the help of Young's rule. With the help of Young's rule. कौन सी बेटा? से Young's rule formula. Child dose equal to age in years divided by age in years plus 12 into adult dose. This is the Young's formula beta for child, for pediatrics. Child dose equal to age in years divided by age in years plus 12 into adult dose. Right? Into adult dose. Right, option C is the correct answer. Next question, question 363 beta. Angle used for giving IM injection is option A 45 degree, option B 90 degree, option C 30 degree, option D 60 degree. So which option is the correct answer? फटाफट आंसर कर दियो बिना भूल करके. Option B is the correct answer, 90 degree. Next question, question number 364 है. A clinic nurse is administering monovalent hepatitis B intramuscularly to a newborn prior to hospital discharge. Which side is best for the nurse to plan to administer the injections? Option A rachi deltoid, option B rachi ventrogluteal, option C dorsogluteal, option D vastus lateralis. So which option is the correct answer? Which option is the correct answer? So correct answer is beta vastus lateralis, right now. Which side is the best side for nurse plan to administer the injections for a newborn prior to hospital discharge? Anywhere giving hepatitis B intramuscular injections to the newborn. So Vestus lateral is our correct answer. Beta option D is the correct answer. हाँ ना नहीं? And this is safest and safe and effective absorption site. Next question number 365 रुचि. Drug of choice is anaphylaxis reactions. It is most important MCQ. बेटा most important MCQ फटाफट आंसर कर दिया. Atropine, epinephrine, digoxin, dobutamine. Drug of choice anaphylaxis reactions each. Most important MCQ. Atropine, epinephrine, digoxin, dobutamine. So which option is the correct answer? So correct answer is beta option B, epinephrine और एड्रेनालिन. कौन क्वेश्चन थे बेटा? एपिनेफ्रिन और एड्रेनालिन दिया हुए बेटा एनाफाइलेटिक रिएक्शंस रे, राइट? एनाफाइलेटिक रिएक्शंस रे एड्रेनालिन इज द ड्रग ऑफ चॉइस. नेक्स्ट क्वेश्चन नंबर 366 रची बेटा. बेंजीमिडाजोल यूज्ड इन ट्रीटमेंट ऑफ पैरासिटिक इन्फेक्शंस. इच ऑप्शन इज एंटी फंगल ड्रग. ऑप्शन B is a broad spectrum antibiotic. Option C is a broad spectrum anti-helmintics. Option D is none of the given options. So which option is the correct answer? So correct answer is beta option C, a broad spectrum anti-helmintics. So option C is the correct answer beta. Option C is the correct answer. Next question number 367. The first drug of choice to treat anaphylactic reactions is option A corticosteroid. Option B epinephrine. Option C antihistamines. Option D bronchodilators. So correct answer is beta epinephrine, right? Option B is the correct answer, epinephrine, right? Epinephrine is the correct answer. Next question number 368. Parkland formula for fluid calculation in one patient. Parkland formula for fluid calculation in one patient should be calculated by option D 4 ml ringer lactate per kg per total body surface area. Option B is 3 ml ringer lactate per kg per total body surface area. Option C is 2 ml ringer lactate per kg per total body surface area. Option D is 1 ml ringer lactate per kg per total body surface area. So which option is the correct answer beta? Which option is the correct answer for H per Parkland formula? So correct answer is beta option A, 4 ml ringer lactate per kg per total body surface area. TBS total body surface area. And this formula provides the estimates the total requirements for 24 hours, right? For 24 hours. 24 hours after a burn injury. So half of the calculated fluids given and administered in 8 hours. 8 hours bhitar half of the fluids are administration. Half of the fluids administered within 18 hours, and rest of the fluids to be administered with next 16 hours, right? H per what? Parkland's formula, right? Next question beta. Which of the following drugs would be prescribed for a patient who had barium anemia? Which of the following drug would be prescribed for patient who had barium anemia? ऑप्शन ए laxative, ऑप्शन बी neomycin, ऑप्शन सी antacid, ऑप्शन सी zinc. So which option is the correct answer beta? So correct answer is option A, laxative. Option A is the correct answer. Option A is the correct answer. Which of the following drug would be prescribed for a patient who had barium anemia? That is laxative. Laxative prescribed after barium anemia to help the patient expel the remaining barium from the colon, right? से पे हमको laxative दवा को पड़ुछि पेशेंट को इंश्योर करा हुए कि plenty of fluids or plenty of water drinking करवा पाए, right? ताकि बेरियम अदरवाइज बेरियम कौन करे बेटा कंस्टिपेशन करेगा बेरियम एनिमा कौन करे कंस्टिपेशन करे से पे हमको लैक्सेटिव्स भी दवा को पड़ुछि हाँ ना नहीं लैक्सेटिव देला पर आराम से प्रॉपर्ली स्टूल पास हबो सबटेन करबो स्टूल को एंड आमे पेशेंट को कौन कहबा प्लेंटी ऑफ फ्लूइड्स नबा को कहबा प्लेंटी ऑफ वाटर एडिक्वेट वाटर्स हमको पीवा पई पड़िबो नेक्स्ट क्वेश्चन Question number 370 रची बेटा a nurse which carrying an older patient with congestive heart failure the nurse can anticipate which medicines will prescribed by the healthcare provider option A रचे amiodarone option B रचे clopidogrel option C रचे aspirin option D रचे dioxin so which option is the correct answer beta so correct answer is beta dioxins right nurse is carrying an older patient with congestive heart failure the nurse can anticipate which medicine will be prescribed by the healthcare provider dioxins right the drug of choice in heart failure is digoxin drug of choice in heart failure that is better digoxin right Next question, question number 371 is which of the following medicines is used for fetal long maturity? Which of the following medicine is used for fetal long maturity? Option A is betamethasone, option B is endomethacin, option C is terbutaline, option D is IFA. So which option is the correct answer beta? The correct answer is very good Lalita Mahananda. Option A. Option A is the correct answer. Injection betamethasone for long maturity used for long maturity हाँ ना injection betamethasone used for long maturity option A is the correct answer next question question number 372 is recommended dose of adrenaline or epinephrine during neonatal resuscitation most important MCQ एटा आसुची बेटा right most important MCQ recommended dose of adrenaline or epinephrine during neonatal resuscitation option A रची 1 milligram per kg body weight that is 1 ml in 1 is to 1000 dilutions option B 0.1 milligram per kg body weight that is 0.1 ml in 1 is to 10,000 option C 0.01 milligram per kg body weight 0.1 ml in 1 is to 10,000 option D 0.5 milligram per kg body weight that is 0.1 ml in 1 is to 1000 so which option is the correct answer beta most important MCQ सीटा ये क्वेश्चन टा एग्जामिनेशन रे आसीबो एवं आसुची मध्य राइट so correct answer is beta option C right 0.01 milligram per kg body weight and 0.1 ml in 1 is to 10,000 right this is the recommended dose of adrenaline during neonatal resuscitation this is the recommended dose of adrenaline during neonatal resuscitation beta option C is the correct answer right option C is the correct answer most important MCQ next question question number 373 which of the following is an example of basal insulin which of the following is an example of basal insulin option A is regular insulin option B is NPH insulin option C is glulisine insulin option D is degludex insulin which of the following is an example of basal insulin regular insulin option B is NPH insulin option C is glulisine insulin and option D is degludex insulin so which option is the correct answer beta So three types of basal insulin beta कौन कौन हम कहि दउची three types of basal insulin कौन कौन सेटा बेटा फर्स्ट अछि glargine also basal insulin, then detemir also basal insulin, and degludec third अछि degludec. These all are the type of basal insulin, right? Three types of basal insulin. So which option is the correct answer? But option D is the correct answer. Next question number 374 is patient with tuberculosis who is on isoniazid therapy should also be administered. Option is thiamine, option B is reformation, option C is nicotinic acid, option D is pyridoxine. So which option is the correct answer beta? Which option is the correct answer? So correct answer is which option? Correct answer is option D, right? So anti-tubercular drugs कौन करे बेटा? Peripheral neuropathy करे, right ना? Peripheral neuropathy करे, right? It can cause peripheral neuropathy. This is a side effect of anti-tubercular drugs, right? So isoniazides, right, interfere करबनी बोली कि आमे विटामिन B6 देथाउ बेटा, that is pyridoxine विटामिन B6 देथाउ isoniazid सहित, right? And जेमती pyridoxine रो डेफिशिएंसी हबो नै, अदरवाइज यदि विटामिन B6 डेफिशिएंसी हे जिवो, pyridoxine डेफिशिएंसी हे जिवो ताहले पेरिफेरल न्यूरोपैथी हबो ड्यू टू isoniazids medications, right? So option D is the correct answer beta. Next question number 375 is what is the antidote of heparin? What is the antidote of heparin? Most important MCQ. फटाफट आंसर कर दिलो. ऑप्शन ए प्रोटामिन सल्फेट, ऑप्शन बी विटामिन के, ऑप्शन सी एस्पिरिन, ऑप्शन डी वारफेरिन. सो व्हिच ऑप्शन इज द करेक्ट आंसर? सो करेक्ट आंसर इज बेटा प्रोटामिन सल्फेट. समस्त को जाना गुलिवर भी नहीं एक क्वेश्चन रा आंसर बेटा. व्हाट इज द एंटीडोट ऑफ हेपारिन? दैट इज प्रोटामिन सल्फेट. प्रोटामिन सल्फेट इज द antidote of heparin. Heparin is an anticoagulant. It prevents blood clotting, right? Heparin is an anticoagulant. This is an anticoagulant and it prevent blood clotting. Next question number 376. What is the purpose of neomycin administration before the surgery? Option A is prevent post-operative infections. Option B is decrease bacterial growth in pre-operative period. Option C is prevent constipation. Option D is prevent gas formations. What is the purpose of neomycin administration before the surgery? Option A is prevent post-operative infections. Option B is decrease bacterial growth in pre-operative period. Option C is prevent constipation. Option D is prevent gas formation. So which option is the correct answer beta? So correct answer is option A, prevent post-operative infections. Option A is the correct answer, right? Next question number 377. Drug of choice for organophosphate poisoning, OP poisoning. So drug of choice for organophosphate poisoning or OP poisoning. So option A is atropine. Option B is pralidoxime, option C adrenaline, option D naloxone. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option A, atropine. This is the drug of choice for OP poisoning, organophosphate poisoning, right? Atropine is the correct answer beta. Next question number 378 is the inotropic medications primarily. The inotropic medications primarily, option A decrease after load, option B increase the force of contractions, option C decrease preload, option D decreases heart rate. So which option is the correct answer? फटाफट आंसर कर दो बेटा. Inotropic medications primarily decrease after load, option B increase the force of contraction, option C decreases preload, option D decreases heart rate. So correct answer is beta option B, decreases the force of contractions, right? Decrease the force of muscles contractions. decrease the force or energy of muscle contraction. This is positive ionotropes and increase the force of myocardial contractions. Force of myocardial contraction, right? Next question, question number 379. People with mechanical valves request to take these medication lifelong. Option A antipyretics, option B analgesics, option C anticoagulants, option D antibiotics. So which option is the correct answer? People with mechanical valves require to take this medication lifelong. Option A antipyretic, option B analgesics, option C anticoagulant, option D antibiotics. So which option is the correct answer? So correct answer is बेटा anticoagulants लाइफ लॉन्ग नेवाकू पड़े जो मानक मेकानिकल valves लगी था बेटा. Next question, question number 380 रची बेटा. Aspirin is contraindicated in dengue because most important MCQ. Aspirin is contraindicated in dengue because option A its antiplatelet activity, option B increased chance of GIT bleeding, option C its painkiller action, option D its blood clotting actions. So which option is the correct answer beta? So correct answer is option A, its antiplatelet activity. It's antiplatelet activity. Aspirin is not given to the patient with dengue fever. It can increase the risk of bleeding, bleeding complications. So डेंगू फीवर कौन हुए बेटा? थ्रोम्बोसाइटोपेनिया हुए, लो प्लेटलेट काउंट हुए नहीं, थ्रोम्बोसाइटोपेनिया हुए, हाँ ना नहीं, लो प्लेटलेट काउंट हुए, हाँ ना नहीं, लो प्लेटलेट काउंट हुए, and which can lead to bleeding, हाँ ना नहीं. Next question, question number 381 है. Initial dose of atropine in bradycardia is initial dose of atropine in bradycardia is most important MCQ, but most important MCQ. So option A is 0.6 milligram, option B is 1 milligram, option C is 2 milligram, option D is 1.5 milligram. So which option is the correct answer? फटाफट आंसर कर दो. So H पर ACLS or advanced cardiac life support. So initial dose of atropine in bradycardia कितने बेटा? Option B is the correct answer, right? Option B is the correct answer बेटा. तापरे after 3 to 5 minutes पर हमें again repeat दी परिबा maximum total dose of 3 milligram, right? When repeated every 3 to 5 minutes up to maximum total dose of 3 milligram, right? So dose can be repeated after 3 to 5 minutes up to maximum total dose of 3 milligrams, right? So option B is the correct answer, 1 milligram. This is the initial dose of atropine in bradycardia, right? Next question, question number 382 rachi beta. A patient with ventricular fibrillation and is going to shock, which medication will be expected to prescribe by doctor? Option A atropine, option B epinephrine, option C amiodarone, option D vasopressin. A patient with ventricular fibrillation and is going to shock, which medication will be expected to prescribe by doctors? So which option is the correct answer? So correct answer is beta amiodarone, right? When patient is in ventricular fibrillation and requires defibrillations, right? Shock means require defibrillation na beta. So the primary medication administration to help restore a stable heart rhythm, it is antiarrhythmic drug, that is amiodarone, right? Next question, question number 383 rachi beta. A child admitted with eye infections disease, ophthalmologist prescribe antibiotic eye drops. The eye drops administered in option A rachi upper eyelid, option B lower eyelid, option C inner canthus of eye, option D outer canthus of eye. Most important MCQ. Most important MCQ beta. Which option is the correct answer? So correct answer is beta option B, lower eyelid, right? Lower eyelid is the correct answer, right? So the correct place to administer the eye drop is in lower eyelid. Lower eyelid. is the correct answer. Option B is the correct answer. Next question, question number 384 is drug of choice to treat leprosy is option A rifampicin, option B is acyclovir, option C is judovidine, option D is dapsone. So repeating like questions, nahi. So correct answer is dapsone. Dapsone is the drug of choice to treat leprosy. Option D is the correct answer. Next question, question number 385 is the drug that increases both systolic and diastolic blood pressure for prolonged period is the drug that increases both systolic and diastolic blood pressure for prolonged period is option A is dopamine, option B is ephedrine, option C is epinephrine, option C is dopamine. So which option is the correct answer? So which option is the correct answer, beta? So ephedrine is the correct answer, beta. Ephedrine is the correct answer. Ephedrine is this is a androgenic receptors, beta, and this action causes vasoconstrictions and increased cardiac output when it resulting in elevation of both systolic and diastolic blood pressure. So option B is the correct answer. Ephedrine is the correct answer, beta. Next question, question number 386. Paracetamol is an option H antipyretic, option which antitussives, option C is antibiotics, option D is antiemetics. So which option is the correct answer? फटाफट आंसर कर दे बेटा, এটা ভুলভাল না হবার আছে। So which option is the correct answer? Paracetamol is an answer, এটা ভুল করো, যে ভুল করবে সে মার খাইবো। So correct answer is, which option is the correct answer? फटाफट आंसर कर दे बेटा, फटाफट। Antipyretics. Paracetamol is an antipyretics, right? Paracetamol is otherwise known as कौन बेटा, और कौन कहते acetaminophen. Acetaminophen. Paracetamol is otherwise known as acetaminophen, है ना नहीं? Acetaminophen. Acetaminophen भी कहते हैं ना नहीं? So paracetamol the antidotes कौन बेटा? N-acetylcysteine. N-acetylcysteine. Paracetamol रो antidote, right? Paracetamol और acetaminophen रो antidote जो पचला N-acetylcysteine करवा बेटा. So correct answer is option A, antipyretic. Paracetamol is an antipyretics, right? Next question, question number 387. If 3 tablespoon total body surface area of milk of magnesium syrup gives to a patient, then how much milliliters would be given to the patients? So 3 tablespoon total milliliters हमको पता चलता है, total milliliters, right ना? So 3 tablespoon है ना नहीं? So how much milliliters would be given to the patients? 3 tablespoon into 15 ml per tablespoon, right ना? Per tablespoons. So केते है बेटा? Total milliliters 45 ml है। So correct answer is option A. Option A is the correct answer, right? Next question, question number 388 अछि red orange urine indicates side effects of option अछि pyrazinamide, option which is rifampicin, option C is isoniazid, option D is ethamotil. So which option is the correct answer beta? So red orange urine indicates side effects of, so correct answer is beta rifampicin. Red orange urine can be side effects of certain medications like rifampicin, है ना नहीं? Next question, question number 389. Resonance is best described as option A drum like sound, option B hollow sounds created by air-filled lungs, option C is short high pitched thudding, option D moderately loud sounds with म्यूजिकल क्वालिटी. So which option is the correct answer beta? The correct answer is option B. Hollow sounds created air-filled lungs. है ना नहीं? Resonance refers to the hollow sounds made lungs filled with air. Right option B is the correct answer. Next question, question number 390. The classical substance that increases the sensitivity of pain receptors by enhancing the pain-provoking effects of bradykinin is. The classical substance that increases the sensitivity of pain receptors by enhancing the pain-provoking effects of bradykinin is. Option A nocicepto, option B endorphins, option C encephalin, option D prostaglandins. So which option is the correct answer? So correct answer is prostaglandins, right? The substance that increases sensitivity of the pain receptors by enhancing the pain-provoking effect of bradykinin is prostaglandins. Beta, prostaglandins, right? Option D is the correct answer. Next question, question number 391. NADPH required for a fatty acid synthesis can come from. Option A hexose monophosphate shunt. Option B oxidative decarboxylation. Option B oxidative decarboxylation of malate. Option C extra mitochondrial oxidation of isocitrate. Option D all of these. So which option is the correct answer beta? So correct answer is all of these beta. NADPH required for fatty acid synthesis can come from hexose monophosphate shunt, oxidative decarboxylation of malate, extra mitochondrial oxidation of isocitrate. So all of the above are correct answer, right? So option D is the correct answer. Next question, question number 392. During CPR ratio of adrenaline dilution is used. Most very important beta. Very important MCQ. So during CPR ratio of adrenaline dilution is used. Option A 1:1000. Option B 1:10,000. Option C 1:1 lakh. Option D 1:100. So which option is the correct answer beta? So correct answer is beta option B 1:10,000. 1:10,000 is the correct recommended dilution of adrenaline for intravenous administration. 1:10,000. 1:10,000. This is the recommended dilution of adrenaline, right? So this means beta every 1 milligram of adrenaline is diluted with 10 milliliters of solutions, right? 1 milligram of adrenaline diluted with 10 milliliter, 10 ml of solutions, 10 ml of distilled water, DW, right? Next question, question number 393. Most of the medications error occur because of a flaw at which stage? Option A prescribing, option B transcribing, option C dispensing, option D administering. So which option is the correct answer beta? Most of the medication errors occurs because of a flaw at which stage? Option A prescribing, option B transcribing, option C dispensing, option D administering. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option D, administering, right? Most of the medication error occur because of flaw at which stage? Administering. During. So the most common types of medications error, 54% of medications error made at the point of administration. During administration, right? During administrations. So 54% of medication error occurs during administrations of drugs. Next question, question number 394 अछि 1 teaspoonful is equal to 1 teaspoonful is equal to how much ml? 15 ml, 10 ml, 5 ml, 20 ml. So which option is the correct answer? फटाफट आंसर कर दे, जो मन को उसे फटाफट आंसर कर दे, फटाफट without any delay. 1 teaspoonful is equal to 15 ml, 10 ml, 5 ml और 20 ml. So फटाफट आंसर कर दे बेटा, फटाफट आंसर करो. Very good, very good. 5 ml, right? 1 teaspoonful is equal to 5 ml. Very good. Next question, question number 395. Which drug is used for alcohol withdrawal symptoms? Which drug is used for alcohol withdrawal symptoms? Option A disulfiram, option B chlordiazepoxide, option C acarbose, option D naloxone. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया. Which option is correct? So correct answer is chlordiazepoxide. So option B is the correct answer. So drug used for alcohol withdrawal symptoms is chlordiazepoxide is the correct answer. This is the benzodiazepine group of drugs commonly used to manage alcohol withdrawal symptoms. Right? So option B is the correct answer. Beta, next question, question number 396. Spironolactone is an example of option A loop diuretics, option B thiazide diuretics, option C potassium sparing diuretic, option D osmotic diuretic. So which option is the correct answer? Most important MCQ. Spironolactone is an example of loop diuretic, thiazide diuretic, potassium sparing diuretic, option D osmotic diuretic. So which option is the correct answer? So correct answer is beta potassium sparing diuretic. Spironolactone is an example of potassium sparing diuretics. Next question, question number 397. Which of the following antihypertensive drug can safely administer in breastfeeding or lactating mother? Which of the following antihypertensive drug can safely administer in breastfeeding or lactating mothers? Most important MCQ. So lactating mother किंबा breastfeeding mothers को हमें को antihypertensive drugs safely दे पारिबा. Lisinopril option B रचे, enalapril option C रचे, losartan option D रचे, hydrochlorothiazide, so SCZ. So which option is the correct answer beta? So option D is the correct answer. Hydrochlorothiazide SCZ हमें दे पारिबा safely during breastfeeding or lactating mothers. Next question, question number 398. If NTG given to a client who is suspected for heart attack, then NTG is working in best way if a patient option is feel burning sensation under the tongue, option B medicine given in a dark room, option C feel mouth itching, option D feel blood vision. So which option is the correct answer beta? So correct answer is option A, feel burning sensation under the tongue, right? So nitroglycerin is a vasodilator medication and commonly used to treat angina and suspected heart attack, right? So NTG कौन पे use करा जाए बेटा? For it is used to treat angina and कोथरे बेटा suspected heart attack रे दिया जाए, suspected heart attack रे दिया जाए, right? And NTG administer sublingually, right? NTG administer sublingually, right? Sublingually. It works best if the patient experiences a burning or tingling sensation under the tongue, right? So option A is the correct answer beta. Next question, question number 399. How to confirm right placement of the NG tube? How to confirm the right placement of the NG tube? Most important MCQ. The Ryle's tube or nasogastric tube केमती हमें जाने बा confirm right placement अच्छी बोले की. तो ऑप्शन ये aspirate gastric content and assess for 3.5 to 5 pH. Option B check the auscultation for bowel sounds. Option C tape a NG tube with a nose. Option D marking of tube while inserting. So which option is the correct answer? So option A is the correct answer beta, aspirate gastric content and assess for 3.5 to 5 pH, right? कन्फर्म आहुरी जानवा पई हमें चेस्ट एक्सरे करि पारे बेटा चेस्ट एक्सरे करवा उचित फॉर एक्यूरेट प्लेसमेंट कंफर्मेशन फॉर एक्यूरेट प्लेसमेंट कंफर्मेशन राइट नेक्स्ट क्वेश्चन नंबर 400 बेटा आज का लास्ट क्वेश्चन दिस इज द लास्ट क्वेश्चन फॉर दिस evening sessions. If a patient with history of MI can give a MAOI antidepressant when then what will be the possible complication occurs? If a patient with history of MI myocardial infarctions can give MAOI antidepressants, then what will be the possible complication occurs? Option A hypertensive crisis, option B glaucoma, option C dysarrhythmia, ऑप्शन डी टैकीकार्डिया. सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा फटाफट आंसर कर दिया बेटा डेली आम जमी 6 PM रे क्लासेस करुचे सेमती प्रत्येक दिन 6 PM रे क्लासेस हम राइट एवं जो संडे जो तुम कहूला संडे दिन गोटे सबू सब्जेक्ट कंबाइन सब्जेक्ट क्वेश्चन आंसर डिस्कशन हो सर बोली कही संडे संडे धमाल बोलिकी शेड्यूल कर देछि बेटा संडे धमाल रे सबू क्वेश्चंस आमे देखिबा संडे दिन राइट 2 PM रु क्लासेस हम पूरा इवनिंग जाए राइट अप टू इवनिंग 2 PM रु स्टार्ट है अप टू इवनिंग जाए खाई पी की पूरा क्लासेस करबा इवनिंग जाए राइट संडे दिन प्रत्येक संडे दिन संडे धमाल हम बेटा राइट एंड एवरी डे आम 6 PM रे महा मैराथन क्लासेस करुचे समस्ते जॉइन हो. सो को ऑप्शन हम करेक्ट आंसर बेटा सो ऑप्शन A is the correct answer. Very good. Hypertensive crisis is the correct answer. So MAOI monoamine oxidase inhibitors are the type of antidepressant medications, right? So MAOI can increase the risk of hypertensive crisis, beta, right? And this is the life-threatening conditions when increase the blood pressures. हाँ ना नहीं? सो ऑप्शन ए इज द करेक्ट आंसर बेटा. थैंक यू सो मच जो मैंने लाइव क्लासेस रे जोड़ी होते. सो वीडियो को लाइक कर दियो शेयर कर दियो और चैनल को फर्स्ट टाइम देखुच चैनल को निहाती भाव रे सब्सक्राइब कर दियो बेटा. बहुत गुड़े कंटेंट तुम रखा है से सब आम डिस्कसन करवा प्रत्येक क्लासेस रे प्रत्येक क्लासेस मोस्ट इंपोर्टेंट जो मैंने प्रीवियस क्लासेस सब देखी ना प्रीवियस क्लासेस देखी नि राइट बहुत गुड़ा इंपोर्टेंट MCQ आम डिस्कसन करुँ प्रत्येक सेशन रे राइट ना गोटे सेशन देखी बेटा आम सब क्वेश्चन आंसर करदेवा कि माने ना प्रत्येक क्वेश्चन आमको देखिबार प्रत्येक क्लासेस जहाँ भी डिस्कशन है राइट. सो बेटा थैंक यू सो मच टू वन एंड ऑल जो मैंने आज लाइव क्लासेस रे जोड़ी होता. थैंक यू ललिता महानंद थैंक यू सो मच राइट. चैनल को सब्सक्राइब कर दियो एवं वीडियो शेयर कर दियो निज निज फ्रेंड पाक जमती समस्त देखिपारे एवं सब समस्ते आम माध्यम किछिटा नॉलेज गेन करें राइट. निहाती भाव में चैनल को सब्सक्राइब करके वीडियो को लाइक कर शेयर कर दियो बेटा. आज क्लास एति नेक्स्ट क्लास पुणी देखा से पर्यंत टेक केयर एंड बाय बाय एंड बेटा स्टे मोटिवेटेड एंड पाठ पढ़ा कंटिन्यू चलित हो पाठ पढ़ा बंद हो ना जब तक तोड़ेंगे नहीं तब तक छोड़ेंगे नहीं राइट ना. ये पर्यंत आम नर्सिंग ऑफिसर्स गवर्नमेंट जॉब है से पर्यंत आमको पाठ पढ़ा पड़ो. दिस इज आवर मेन गोल हाँ कि नहीं ये पर्यंत आम गवर्नमेंट नर्सिंग ऑफिसर जॉब है ना से पर्यंत आमको पाठ पढ़ा पड़ो. बहुत गुड़े पोस्ट बाहर बेटा आमको टिके प्रिपेरेसन करदे आमर सिलेक्शन है जो बहुत गुड़े पोस्ट एमती अपरच्युनिटी नेक्स्ट आसब न आसब किसी ग्यारंटी ना बेटा से भल भाव में पाठ पढ़ मन ध्यान देखी निजर समय नष्ट न करिकी भल भाव में पाठ पढ़ा पड़ो. थैंक यू वन एंड ऑल गिरीश महापात्र रचना गौड़ सारला पंडा कावेरी मलिक थैंक यू ऑल एंड गॉड ब्लेस टू ऑल ऑफ यू. ओके.